MBE, Jamie, we're very proud of you. Thank you. Welcome to Tom Shepherd over in the corner. Your CCG and Communications, is it, Tom?
That's right.
Yeah. We've got Lois from the trust, and anybody else with that name? Michaela's new, so this is your first scrutiny.
About 7 weeks in now, so I don't think I can call myself new anymore, but I'll try and get away with it for another few weeks.
Okay. Welcome, Michaela.
Thank you.
And got Pam somewhere from the patients. You don't have council, right? Okay, so the first thing on the agenda is to confirm the minutes. Can we have a fully proposed and second that?
Yeah.
Proposer, Michael, seconder, Roger's.
While doing that, Chairman, we've got apologies from Councillor David Adams.
We have got people online, and Wendy's right in the middle there. I can't really read who they are.
Yeah, we've got a running list, Chairman. Yeah.
Yeah. All right. There's Michelle. Yeah.
I'm sure she can see us. Oh, okay.
Yes, I can see you. Thank you.
Michelle. Who else have we got?
The leader's here.
Oh, thank you, Laura. LW, not LBW. What's happened to the P?
Well, there's a question.
Who else have we got?
Steve Parker. Julie Maskery and Elizabeth Kenwood.
We've got Julie Maskery and Elizabeth Kenwood from NHS England.
No, Steve
And
Parker.
is Steve Parker there?
Chairman, Steve's not well.
Okay.
Steve's not well. Okay. Declarations of interest. Has any of the members of the committee got an interest they need to declare? If it turns out that you think of one on an item, just stick your hand up and say. Public questions. The only question that we've had really, and I've spoken to Darren about this before, and Michaela's predecessed it many times, and it's a bug that just doesn't seem to want to go away, is accessible information. When you're putting out publications, just to make sure that that people who are disadvantaged are considered, because it's not fair. And I know you've got an awful lot of things to do, but just to keep an eye on that. I think we've started the issue down rather than the spot it. Thank you.
Chairman, if I could confirm that the Head of Patient Experience has had adoption of the Accessible Information Standard, which is one of her objectives for this year, and we're going to engage our Patient Council in a review of the material that we produce to make sure that it is true.
Thank you, Lois. Item 4, so a progress report. I think we're going to deal with an awful lot of this in the agenda. We are set to have a meeting with Children's Scrutiny to look at suicide prevention. And of course, suicide prevention is a very wide mental health iceberg, so that we're expecting to be quite constructive. Michael?
Yes, I thought it'd be an opportunity for well, the Director of Public Health wanted to update about the Wight Public Health submitted an application to have a local government association be part of a local government association peer review on suicide. We were lucky to be chosen as one of the 15. I know there was a meeting recently which I couldn't actually attend, but I just wondered if Director of Public Health could update us on that. Thank you.
Thanks, Councillor. So we've been selected to be part of what's called a sector-led improvement programme for the Isle of Wight, and really what we're thinking about is how we move forward the good work we've done and make that much more of a collegiate approach across all partners. And I think that will really help us to move forward on the suicide prevention agenda. And Councillor Nichols, I wonder if we want to schedule a scrutiny for after that, so we do the work over the kind of next few months and then come back after that, rather than do it together. That would be probably the best way to do it. We continue to do all the work we're doing around monitoring rates and we've done a lot of work over the last few months, particularly around supporting those who've been bereaved and thinking about real-time surveillance. There's a lot of good work we can share with partners and colleagues.
Thank you.
I think one of the really good things being part of that LGA programme is to look at good practice from other areas and how we can actually learn and integrate that within that. And I'll raise this issue, which I think is within the suicide update. It's a difficult subject, and I'm going to be trying to be very diplomatic, but we do need to be having dialogue with the coroner, and we do need to be getting the, obviously not the detail, but the lessons learned from the suicide, or what's been registered as suicide on the island. Because if we don't actually look at those cases and learn from them, and what the lessons are learned, how are we going to actually improve the services? And I think that role, the coroner's role, is extremely important, and that needs to be engaged, or we need to engage within that review. In the past, that has been a missing player, and I think we do need to make sure that of that, because I know there are a lot of families that I come across, and I know Councillor Modstill has come across, who still got questions to ask, and still, and some of that data has not, come forward. And I think linking into children's scrutiny is important. That some
hello, is that Mr. West?
the very sad deaths
The West
over
is
the last few years have also included young people within that.
Thank you, Michael. I think also following the last scrutiny meeting, I think it's fairly essential that we commence a dialogue with the coroner, and I think when it comes to it, we can put that on our work plan. Simon.
Just two things. That you're absolutely right with the coroner. We have opened those email dialogues and we're trying to pursue that. I just wanted to make the committee and colleagues aware we don't have a high rate of suicide. It's an important issue, but I don't want people to think we have a high rate of suicide.
Just coming back, sorry on that, I think the issue is getting that information from the suicide that do happen on the island, and how do we improve the services. And there is often quite a long delay in getting that information, and that has been historic in our suicide strategy, really. We need to actually make sure that those island facts, so that the island story of suicide is actually in our island suicide strategy.
Joanna.
Yes, I think it's important to not just look at the numbers of successful suicides, but it's important to look at attempted suicides and the rates of self-harm in younger people, because we need to start doing more preventative work in younger people. So I think the joining with the children's scrutiny members would be really useful, just to establish some links between not just suicides numbers, but self-harm, because it's so important to identify when, you know, the red flags are coming out when people are younger.
Karen?
I absolutely agree, and I think following Councillor's comments, we just need to find a way to encompass views, to feed into the review rather than to make comment after the review's happened.
Yeah.
So if we can take an action to work that through, Simon will do that, given that we're providing camp services. Yeah, absolutely. Unless there will be fundamentals.
We have an agenda item under public health partnership, which we're going to bring forward to push item 5 behind it. So yes, I mean the point is that suicide is just the tip of the iceberg, isn't it? There's a lot of other mental health issues that we can address. Dentistry on the Isle of Wight. This is now. I mean, I don't think it's anybody in the room that would disagree with how disappointed, how baffled, how frustrated we've been with the action or inaction of NHS England, and I've now found out that there was a private dentist on the island who wanted to engage and help out with the NHS dentistry situation and was completely ignored by NHS England. So the sooner we see the back of them in that respect, I think the better. And I'd like Michelle McKellar perhaps to give us an update of where she is with the CCG and the ICP taking over.
Thank you very much. And I would echo the comments about the desperate need to improve the state of dentistry on the island. And I know you've probably talked about it very significantly in advance. What I wanted to update people, and I'm not sure how much you have discussed this previously, is that the commissioning of dental services, as well as you might be delighted or not to know, the commissioning of pharmacy and the commissioning of optometry will revert back to the local ICS from the 31st of July this year. So those services will be commissioned across Hampshire and the Isle of Wight, not by NHS England, which I am hopeful is really good news for us on the island and for the Isle of Wight population. And we are currently working together to essentially hand over the transition from NHS England to us. They will still be involved in some of the kind of high level contracting, but the important work on needs assessment and what we actually need to commission and buy on the island for the Isle of Wight population will transfer locally. So that's really positive. And I've had some of the feedback, both from Councillor Nicholson and from Joanna and colleagues, about things you feel should have been completed before. So it's really helpful, as well as the report which you've got in your papers. What I think is really clear, and I'm sure everyone's read the NHS England assessment that's in the papers, is what I find slightly frustrating is it is very clear that the level of dentistry that is commissioned, i.e. that which we plan to buy on the island, is actually much higher than quite a lot of other places across Hampshire, if you look at the detail. But we've clearly struggled to attract and retain the workforce that can deliver that NHS work, and it's really encouraging, Councillor Nicholson, to know that you've also been in contact with dentists who want to provide more care. So I'm hoping that our next meeting, which I think is in September, we'll be able to discuss in detail what work we've been able to do from July onwards.
Thank you. Councillor Oswald.
Thank you. I have a question, if that's okay. With all of these things, we can encourage people to come and want to work within a service, but what we're going to do to help them deal with all the bureaucracy, there is nothing like being a small dentist and then realising that you've got to fathom your way through the NHS tendering scheme that you know, usually it's computer says no as soon as you turn the computer on. You know, I think we need to make sure that we've got a whole system that we can actually help people get through the first hurdle, because otherwise we're doomed to fail. Are you doing anything to help them with that?
So the honest answer is not today, because we don't take over the commissioning until so I can't do anything about it until the 30th of July. But I couldn't agree with you more. And so part of the benefit it's us being able to work on the island with practices that we can know and build relationships with. And actually, some of my team do already know, because we used to commission Dentistry and then it went back to NHS England, and now it's coming back to the island. So I couldn't agree more. And part of, and I'm sure Simon will talk about something similar later around pharmacies, part of I see commissioning working better locally is us building the relationships with those individuals. So we already know all the dentists on the island, we already know all the pharmacists on the island and the optometrists, even though we don't commission from them. So things like working together to cut through the bureaucracy and support them to work is exactly why it should be coming back local. So I couldn't agree more. And yeah, that is what we'll be doing. What I would say, and I know this is probably slightly disappointing, is it's not going to get fixed overnight. So what, you know, if we take over on the 31st of July, it isn't going to be better on the 1st of August, just in terms of managing expectations. But we can work on it really rapidly once we are able to commission it.
It's encouraging, Michaela, to know that you're anticipating the issues.
Yeah.
So thank you for that.
I'm doing a lot of anticipating issues, don't worry.
Now we've got Joanna next, and then we've got Councillor Lilly.
Thank you. Yes, Michaela and I have had a meeting, and Michaela was already aware of the issue prior to our meeting, which is really heartening. I just can't overemphasise enough the significance this is having on Isle of Wight residents. I've said it before, but it's the biggest health inequality that island people face. It's getting worse. The data in the papers for this meeting show a really heartbreaking story for island families, particularly amongst younger people. So if you look at 0 to 17-year-olds, we've got the worst rates in the southeast for 0 to 17-year-olds accessing NHS dentistry. That's dreadful. It's a worsening situation. And there are particular groups of people that are struggling more because of a lack of NHS dentistry. And I just want to make a point that we have to maintain NHS dental services on the island. It is not feasible for people to travel off the island. Some people choose to do that because they can afford to, because logistically they're able to do that. But many people on the island cannot go to the mainland for NHS dental services. Particularly people now haven't access to dentists for a long time, and they've got problems that need significant amount of treatment. So many people don't just need one visit, they need several visits to the dentist. So we have to keep the facilities on the island for island people. And as Michaela said, the key is to work with dental providers, whether they're private practices or NHS at the moment. Because, yes, we're aware of at least one private dental practice that is willing to offer NHS services. And they're a good practice. So every dental practice, every dental provider on the island must be involved in this and be part of the solution, because there are positive outcomes that we can deliver short term. There's a charity in Southampton, Dental Aid, that do some work, and they're coming over here to do some work that looked after children, which is wonderful. But more of that hopefully can be commissioned, more additional facilities on the island. So yes, we're at a really bad point at the moment, but there is hope. From the 1st of July, there's hope that local people know what the issues are, and I think there's a resolve to put some of this right. And we can't not act on this. We can't wait another year, another 2 years. We have to do something now.
Thank you, Joanna. Michael, Councillor Lilly.
I think coming on the back of what Joanna has said is that we need to have some kind of solution to cope with the backlog. One of the things quite a few times we have the commissioners from NHS England in front of us, and one of the things that they said was in parts of the country where there was a backlog, they commissioned private dentistry to private dentists to come up with the backlog. And they actually promised at one meeting that they would do this, right? But they didn't deliver at all. And we got an example that Joanna's given of an actual enthusiastic private dentist that was never approached within that. And my other point was going on children, is a lot of the work, the preventative work of dentists, working with family and children right from, from maternity through, has just fallen by the side. And we now have children, particularly in some of the most deprived wards in our communities, who, have got children who are going to have rotten teeth because that pre-work where you need to educate, and sign that was done on the island has just not existed. And we need to have some kind of strategy which stops the tap. It's not something I often go on about. Unless you are targeting the tap, you're going to have within that. And there's a very strong link between low self-esteem and mental health with dentistry. So it's quite interesting. If you look at people who are in mental health services, quite often they've got poor teeth. Right?
Thank you. So we've got Nicola, do you want to come in now in response to that?
Yeah,
then we've got Councillor Love.
Thank you. Just to say, I absolutely understand, Councillor Lily. I am completely with you. I understand all of that, and I am with you that preventative health and early years are absolutely critical parts of it. So what we can't just do is buy additional sufficient capacity and expect that to fix the problem. I do actually know the service that Joanna is referring to in Southampton. I know and have worked with dentists in Southampton who run roving childhood buses where they go around some of the estates you probably all know, like Millbrook and Stony and places, and work with them. And I absolutely recognise that's the kind of model we need on the island. So I just wanted to say to all of you, I absolutely recognise what people are saying. I've done some dentistry commissioning before, so I am with you.
Thank you.
Thank you. Councillor Love.
Thank you for allowing me to speak at your committee because I'm not happy. I just want to thank you for all your comments around dentistry. Certainly Michelle Legg and I have spoken at length about this occasion in our meetings, and Sam Bryant and I have also talked about beacon of our preventative arrangements for the island in terms of going out there. So I think what needs to be really clear is that when we do take over and bring that back to local control, is that it's a long haul. Whilst there's a great deal of hope there, I don't want there to be any false hope given at this point, because the point is that we're going to be inheriting something that's in a worse state than when it left the island's control and was given away, and it's coming back in an even terrible state of operation. And that's going to take quite a lot of reorganising and managing whoever does that. The integrated care partnership has been a regular item on there where we've talked about it, and we do need that task force, that bus approach. So I very much hope that message has been heard. But I think the final thing that I would say is that the additional bit is an additional pressure, because we also have a significant number of refugees who are now coming onto the island, and our childcare within lack services alone is not great for dentistry, which is recognised, but we've been unable to secure that. So hopefully there's a brighter future, but it's over a period of time and not an instant hit. And it is really, I was aware of the private offer of the dentist. It was brought to attention at least 4 months ago, if not. And that, it just confirms to me that localism is the way forward for health and public health, as opposed to it being absorbed into larger and larger integration.
Thank you. And I think, Carl, that every member of this committee would want to support the transition and improvement of dental services, indeed any other service. Darren, did you want to say something?
Thank you. Thanks, Chairman. Yeah, I don't know whether this is certainly not a personal comment, so please don't take it on a personal level. No, right now, some weeks in. But this is a long-standing issue, isn't it? For need to work together on it. And the bottom of page 37 in the pack, page 10 of the report, I didn't know whether to be excited or worried by some of the comments in that paragraph at the bottom. And it talks about, well, what has the highest commission activity anywhere in the Hampshire and Isle of Wight area. As outlined below, both local engagement and published data suggest particular issues. Data hides all sorts of things at a superficial level. And we need to be really careful that we are actually burrowing into that. And I'll use one example. Maybe that we've got higher than comparator units dental activity commission UDAs, but actually the price that we're paying doesn't attract them. 25,000 uncommissioned activity procurement exercise will illustrate that point. So it may be we've got too much at the wrong price. No one wants to do it. If that's the answer, let's work that through and make sure we get it sorted out. That's quite specific. But what interested me was the second sentence. Given this issue of solely is one related to commissioning procurement, to anticipate this problem, and all parties should work together to find sustainable solutions. And I wonder whether this committee wants to see something from us, and I use us in that in due course to say how we're going to do it and the timescale for that to happen. And oh, you're right, it's never going to be sorted overnight. But I think we need a timescale with specific actions. Otherwise, we'll end up talking about it again.
I think that's really helpful, Darren. Thank you very much for that.
No, we needed to bring that in.
Just on your point about the ranking of the deprived, I was in other sections bring up about deprivation data, because we need to get the better deprivation data on them. We are still ranked just after Portsmouth and Southampton, the two biggest urban areas. We're there, right? If you put into proportion into some of our urban or populated areas, you could actually say there are pockets that would match the deprivation in Southampton and Portsmouth, and in fact higher in other areas. But often in rural areas, it gets sort of slowly, it gets sort of slightly diluted. But we have got families that are very highlighted, particularly during COVID, that are in abject poverty. I've got a question later that will go to Jamie about homelessness and housing. We've got a real housing crisis, particularly in the private rented sector. So you've got families that are real desperate, and then that leads to health inequality.
Thank you, Michael. So our next scrutiny meeting isn't until September, and then there's another one in December. So who's going to update us? And we can also have an informal briefing with Peter McKellar.
Yeah, I will.
And if you want an informal briefing, then just say so, and we'll arrange for that.
That's really helpful.
Thank you. Okay, so pharmacies and the Pharmaceutical Needs Assessment. So we have had an awful lot of problems with certain pharmacies on the island recently, which concern staffing, and I think staffing issues. And I think from observation, they seem to have resolved themselves now, and it's pretty much back to normal, but I stand to be corrected. And I think Simon's going to say something on this.
Thank you, Councillor Nicholson. So if I just explain the process of what the Pharmaceutical Needs Assessment is, and it might be indicated to kind of a bit like the dentistry conversation, it's moving over to local commissioning, so that helps us. But the Pharmaceutical Needs Assessment, as set out, is something that every health and wellbeing board, which all parts on the table are part of, has to publish and keep up to date a statement of pharmaceutical services. So it's really about, a bit like we talked about this, the number of pharmacy services that are commissioned. It's not about, and it's about the hours they are commissioned to be open, for example, a 40-hour, 100-hour or less. And the document is for that purpose. It is a very technical document, and it's for pharmacies and others to respond to. we are just have a duty to push this out there and ask people questions. There's quite a clear criteria on what is about need, and in the document you can see that in the executive summary, it's about, is it within 5 miles? Is it accessible to the population within a certain walking distance? How many? And those kind of things. So we look at housing developments and does the pharmacy services meet that? Our job as the council is just to put that out there so that then NHS England currently and then the ICS can see any gaps being identified.
How many pharmacists on the island have responded?
So to my knowledge, we've had about 70 responses so far, which is across the board, but we will wait for the conversation to finish and we'll bring that back, as you'd expect, to the Health and Wellbeing Board, which is the responsible board for the Health and Wellbeing, for the P&A, and that will come through. We'll give an update in July and it'll be signed off in October.
Got Claire, Councillor Mossel, and
Thank you. Is there anything we can do to encourage the public to be able to use services to the best of their example? So I'll give you an example. I know somebody who's an absolute technophobe, but I've taught them how to use the NHS app, and it's amazing. They can now order their prescription, their repeat prescription off the app, and then it pings them and stuff like that. But that's only because I know this person. I've encouraged them to use it. I think, do you not think as a council that we should do more to help the pharmacies back to the system? And if so, what are we going to do about it?
I expect colleagues will be better able to answer Councillor Mossville. So I think you're absolutely right. Let's separate this document from what you're saying, because I think the living and choosing well message really needs, we need to help our population to do that, because we put it out there, but actually can they do that? So I think when we move forward with commissioning, we can then say, actually, this is how we want to engage with our population to improve their health.
so it looks like Michaela's keen to say something.
Yeah. Thank you, Councillor Mossville, and I could not agree more with what you've just said. And I think when we come on to talk about the health watch report into GP access, there's a recurring theme, isn't there, which really worries me, particularly with we are absolutely being pushed nationally down a route that says there are lots of ways we need to or your doctor or your dentist SSA, and they tend to be technologically based. But when you look at the health watch report on pharmacies, a lot of people, I should say my parents included, really struggle with things like e-consult and the NHS app, and all those things would make their life easier. So we can go unless we can also put in the time and effort to train and support people to do that. So I couldn't agree more. What I don't have for you a few weeks into post is a plan in my head of how we collectively are going to do that, but I absolutely think we should have that very clearly as a community on our list of what we're going to do, because unfortunately, a bit like, you know, the world of Amazon Prime, the world is not going to change, is it? We need to be cognizant that there is a risk we exclude people by making technology a way in which you access health and social care, and we cannot afford to do that. So we need to work to say, how are we going to help people use these tools?
Can I just add to that though? I think we have to remember though, and my daughter did remind me yesterday that in 10 years' time I'm going to be really old, just instead of just old.
Yeah, me too.
I thank her gratefully for that. But her point as well was that actually there isn't anybody of my age group that I know who can't use a computer, who isn't with this.
Yeah.
So we are getting to a point that we do have a generation like my mum, etc. Who, you know, she can order shoes online, but you know can't manage to contact the doctor.
Yeah.
Haven't quite worked that one out. But that we are going to get to a generation when as my daughter says, I get really old, and we will already be there. We are embracing the technology we are already used to, obviously. So it's just a limited period, isn't it, that we can't embrace technology to perform.
So Joanna next.
Thank you. I just wanted to mention that we've been contacted by a few people who struggled to access the survey initially. And talking about access, it would have been helpful if there were hard copies of the survey and perhaps a simplified version of the report, because a lot of people didn't have the time or the inclination to read the 40-page reports. And I understand it's a technical document, but it could have been simplified. Given the timing of that survey, given the problems that people have had accessing local pharmacies, many people want to have their say on pharmacies and don't feel they were able to through that survey. We do understand that the situation has been resolved, so there hasn't been a closure, as far as we know, of a community pharmacy for some weeks now. However, we are still getting complaints about people not able to get their medication, pharmacies not having medication in stock, not ordering their medication in time. So we've kind of got a backlog of issues now, perhaps caused by the closures. So we're not out of the woods yet. And you know, it's important to recognise that some of the smaller independent pharmacies have had to pick up the slack for the larger pharmacy chains closing. And so they've been struggling with queues and with a huge increase in demand. So it's had a knock-on effect on other pharmacies and on people's experiences in those other pharmacies. So yeah, it's something to keep an eye on, because local pharmacies are so integral to people's health and well-being, and people are lost without them. So this has just evidenced how important community pharmacies are to people's well-being and to that preventative work.
Do the pharmacies have a place on the ICP? No, why not?
But it's something we need to, sorry. Yeah. Sorry. Michelle, I'm assuming you're still there as the chair of the ICP. I'll take this one. Yeah, is that okay?
I am here, yes, I am here. I could answer for that. I mean, we would be very much interested in working with a pharmacist. The slight problem is that one pharmacist does not represent all pharmacists, and they are individual businesses. And you would need a representative of all pharmacists. You could also extend that out to, do we want ophthalmologists on the Integrated Care Partnership Board and other clinicians? I think what we need to do is maybe form something like a clinical cabinet, which is what they're doing at the Integrated Care Partnership level across Hampshire and the Isle of Wight, where actually these clinical issues can be debated by a wide range of clinicians, including pharmacists, opticians, and then you form a view which you could then proceed through to our local Integrated Care Partnership, or again bring to this board as well. I hope you can hear me all right.
Yeah, that's fine, Michelle. Thank you for that. We've got Councillor Lilly now.
Thank you. I'm just linking to page 74, which was looking at the developments of settlements. So we're not only just looking at pharmacies now, we're looking at the developments. And probably see I'm a councillor on Wight, and Wight gets a huge hit and development. And I want to relate back to COVID. One of the things that had happened during COVID, though, was that pharmacists had to build a relationship with the grassroots, which they hadn't actually built, perhaps the individual cases, but they hadn't actually strategically across the island built that. And for the first time, you had a relationship much stronger with the voluntary and community sector, and particularly parish and town councils. And it was parish and town councils that were very much on the grassroots and the community development. And that's definitely what happened in Ryde in quite a strategic way, and has actually now affected other contracts, like the Living Well contract, is very much now being delivered by that partnership of those voluntary sector and parish and town councils. And can we engage with pharmacists? Because, as Joanna said, they're a bit like the local shop. They give the opportunity to have a dialogue which the GPs don't have time to have. which actually then can prevent the flow coming into the GPs. And we need to really encourage that relationship. And I think we need to have a kind of community health model which engages with the parish and town council, because I think they're now a major player. And one of the things that parish and town council can do, which the other council can't do, it can often give a little money quickly into help groups. So I know that a number of pharmacies and the social prescribers are working with a men's group called Men Only, right? About, you know, doing walks and things for men that are actually quite isolated and depressed and things. And, within that, and actually there was sort of a partnership between the co-op, local pharmacies, GP prescribers, and the town council in actually developing that. So it'd be really good how we could really work with parish and town councils in developing that local grassroots model with pharmacy.
Thanks, Michael. And of course, this falls nicely into the place plans, Cowes, Newport, Ryde place plans, and I think we've discussed this, Michaela and Darren and Simon, and I think you're all keen to take the opportunity to work in development of the place plans. So I'm a bit lost now. So is Michaela, is it next?
So absolutely, yeah, just in response to that. So the development of place plans and those services at locality level is absolutely a core plank of the community transformation plan, and Leslie and people like Tracy Savage, who John, Councillor Nicholson, work with all the time, are integral to that. So it might be really useful if we had a future agenda item around those place plans and around locality, the work we're doing on locality hubs that Councillor Lily has just described. So I think that would be good to consider here in future. What I would say is that despite the fact that pharmacies, a bit like dentistry, are currently commissioned by NHS England, because of some of the issues which you've articulated in terms of short notice closures of pharmacies and specifically closures of some of the larger branches of pharmacies, as Joanna knows, we have actually been working really closely and have now got a really, really strong relationship and are in and out of all of the pharmacies most of the time. So although we don't commission them, that work that you're describing, or we will from July, that work you're describing to build those relationships is there. And I will take back into the team tomorrow that conversation around working with parish councils, because I'm not sure that, if I'm honest, the level of work that's going on. But that is absolutely central to our plans. So if it's okay, Councillor Nicholson, I think it'd be really good to have a localities focus at one of the future meetings, wherever we can schedule it.
John, I'd sit here with a level of concern for this. So we have to remember that your Councillor Lilly is talking as a member of a large Ryde Town Council, and I'm a parish councillor as well, and we like the Vicar of Dibley. We're great. We have the most fantastic time, and we gave a good Jubilee party. But to be fair, getting involved with pharmacies and stuff like that is probably way outside our skill set, or something that, you know, we as a small rural parish council would be interested in. So I just need to put a little
That's helpful.
a little on there, you know. Lots of different parish councils are different sizes, and lots of parish councillors are actually quite elderly and don't want to take on any more than they've already taken on, apart from sort of the general running of that rural community. So, you know, but I think we have to sort of add that to it, really. Thank you.
Thank you. Simon, I think I left you out. I'll give you the closing words.
And that's probably quite helpful. So I just want to say, particularly in response to Joanna's comments, so we're getting feedback on this survey. And what we will do, the ones relevant to the Pharmaceutical Needs Assessment on those questions, we will feed in and be reported back to Health and Wellbeing Board. Other comments will not be lost or pass them to Michaela so that we can develop pharmacy services in a way that's relevant for the island. I just want to be really clear about that distinction. So we will get comments that aren't relevant, and we'll make sure they are fed into the island development.
Right. Rodney, did you want to?
No, sorry.
You just looked as though you wanted
No,
to say
it's on the next item about the patient transport.
Wendy, sorry, Wendy, I'm ever so sorry. It's difficult to see your hand up from here.
That's quite all right, Chair, and thank you very much. I was just going to make a comment on place plans. really, because I think you rightly raised the place plans that were being developed for East Cowes and Cowes and Ryde, and Michaela talked about place planning in terms of health. I just want to make sure we're all on the same page with what we mean by place plans, because I think we're using the same terms for different things. So in the regeneration place plans are not necessarily the same as when we talk about place planning at an ICP level. So I just want to make sure that we're not thinking we're meaning the same things when we're talking about two completely different things.
I think that's a very good point, Wendy, to make, but there is a parallel in the two versions of place plan, and I think what we don't want to do is to duplicate. Oh, do you?
Yeah, because you're absolutely right. It is we are not developing place planning. Neighbourhood plan, but we're not developing a place plan. So the language is really so important.
Yeah.
And it's also, I think I know what really important, because I think what do people understand a place plan to be without going off on a tangent, and what you understand to be a place plan to be might be completely different from what we understand.
Yeah.
And so therefore there needs to be perhaps some synchronisation between what's happening. At that point, we are not developing a place plan.
Absolutely, I agree with your comments. I think the thing is, on the island, there is a number of models which actually have been quite successful. And I think it's about delivering services at community level with active involvement of the community.
Yeah.
And I think that can be done in different ways. There are places like Brightstone that delivered that very effectively and worked with pharmacies and things in delivering, during COVID. We've actually learned from those models, and it's what fits with that community. And I think it's being able to have that dialogue in different places, different communities, have different ways that they want to actually tackle it. But it's getting that voice and getting those resources and getting those communities doing it the way that they want to do it.
Thank you, Michael. Darren, did you want to say final?
Just to try and wrap this up into some action, if you like, going forward. So shall I meet with Wendy, Michaela initially, and we'll start to produce something that we can think about this together.
Yeah.
What we call it is important, but it's less important than we do.
Yeah, agreed.
We're doing some things. So let's.
Perhaps we can have a meeting when Michaela's ready to report back, and we'll put a bit of time into the meeting.
I think so. I think what I'd also stress, given the comments, particularly from council colleagues, is that language is really important. We're coming at this from lots of different perspectives, and it isn't just a single place. Single organisation. That was a Freudian slip, sorry. It isn't just a single organisation that needs to do this. I think, Wendy, given your comments there, it's really important that Jamie and others are involved in what we're doing as we're going forward.
Good.
Regeneration, colleagues. Absolutely.
Good. Thank you very much for that. I think we're going to have constructive progress on that. So now we're going to do public health partnership. Oh, sorry, patient transport. Sorry. Patient transport, yes. So patient transport, this is a really thorny issue that people that don't, organisations that aren't based on the Isle of Wight just fail to, consistently fail to appreciate. And I know that the cabinet members been doing quite a lot of campaigning that's reached the county press and raised the issue, and we've had a meeting with a cabinet member and the trust, who are also very proactive on this, on the basis that the sum of the two is greater than that of the individual parts. And I think from our meeting, Darren, that was quite clear. So if you'd like to introduce this, Darren, from your perspective, and then
Thank you.
Councillor Mostyn.
I can only anticipate the questions, Councillor Mostyn. Given this is a long-standing issue, isn't it? And what this is a step forward, I think. It's not the only step that we need to take, and it's not the final step. But really, really useful meeting with the cabinet member, I think, a few weeks ago, that you kindly facilitated, and the trust will do, as I'm sure organisation ICB will do everything it possibly can to ensure our population receive treatment in the best place. But if they need to travel, then there's a subsidy or a fully met cost to that as we move forward. It's a long-standing issue. I'm sure there are lots more questions. This is a step forward, I think, a positive step forward, but it's not the only one.
Thank you. Councillor Downer. Oh, sorry, Councillor Mostyn, then Councillor Downer, and I think did Councillor Robinson quickly want to say something on this or not?
In the papers, it says patient travel. I was really excited to get to this bit. And in the papers, you know, I do my stuff online because I think it's obscene print and all this paper. So I got to page 105 and 106 just to find this 2-page document that says council covers parking costs for NHS patients. So still getting excited about reading this, but the devil's always in the detail, isn't it? So this travel, you know, being able to park, there is only 2 car parks that the scheme will apply to. One's in Key Road in Ryde and the other's in River Road in Yarmouth. Nothing for anybody who's travelling to Southampton. You know, you would have thought that there was enough car parks in Cowes that something could have been thought up there. There isn't, you know, if you are unwell and you're going to go park in a car park, you're not going to think where the hell is the Key Road car park in Ryde. And I just don't get why there's only 2 car parks. And then it looks like quite complex. You know, you can then apply for a refund if you manage to get into those 2 car parks, and still not sure what you're doing to go to Southampton. And then it says people are excluded from the scheme. Patients attending treatment at a private hospital. Well, there is lots of cataract operations and stuff like that at the moment that are actually being done at private hospitals, but on the NHS. So shouldn't we look at some of the detail of this a bit more thoroughly? That if you're having an NHS treatment, but you're having it at a private hospital, why are you being excluded for your parking because you're going to a private hospital? You know, the whole point is to get rid of waiting lists and things like that, isn't it? And it is expensive to park, isn't it? That's just my couple of things that I instantly picked up reading it. And I was excited to see a great big patient travel document. I was disappointed that we only got 2 pages, 105 and 106 in the papers.
Thank you for that, Claire. I think that there is an arrangement with North of House in Cowes. I'm looking towards Laura.
Don't say that here.
Now.
Yes, I can confirm, Councillor Nicholson, that while I was mayor, I did manage to get the scheme in place, along with Cowstown Council and Northwood House have been operating for over 3 years now, a parking scheme for patients travelling and using Red Funnel. Thank you.
Sorry. This is actually part of a press release. So when this press release came out, you know, one of the things we say about patient travel is to make it as easy as possible. Should that not have been put in this press release? You know, we're having that information given to me at a scrutiny meeting, and it should have been part of this press release if that was available.
Yeah, perhaps we can correct that. So right, next is Councillor Downer.
Work.
Never mind, it keeps me still from it.
Well, I've got to force up a foghorn, so it's different, isn't it? What I would like to ask is, are they letters to patients from mainland hospitals where they would have appointments, but there's no information about transport in there? Now, I've had a resident contact me about this, and they were extremely worried about how to get over there. And fortunately, I had one of the hospital letters that gave information about transport. Now, this particular patient had been sent out in general, but there was no information about how to get there or whatever discounts were available for transport. So would that be prudent to ask those hospitals to provide full information to these?
I'll take the action. I'll take the action to follow that up. So I know that currently, where Darren and I are working together to do work to clear waiting lists, and we're asking people if they would like to have treatment on the mainland, as we've done recently. We are working really closely with patients to do things like offer the payment for the transport and to give them information leaflets of tell them how to get there and to arrange buses and all those kind of things. In the past, it might be that we haven't done that quite as well. So one of my colleagues is with me here today, and I will pick that up because it wouldn't be difficult for us to ask them to include information. You probably know we've been working with the mainland hospitals to try and do things like organise appointment times for Isle of Wight patients at a time that is much easier. So it's no good giving somebody the 9 o'clock appointment at London General because they can't actually get there in time. So we're already working with them on things like that. So we'll pick up the patient information leaflets. Thank you for telling me, I didn't know that.
Thank you very much. The letter that the gentleman had was a bit like mushroom culture. Thank you. In the dark.
Councillor Quigley.
Yeah, just generally around patient transport, I think the intent of this parking scheme is good, but I just, I mean, it doesn't, you know, I'm computer literate, as Claire keeps making the point, is I don't think I could be bothered to go through all the hassle if I was worried about a hospital appointment. I think maybe it's got carried away with providing something that doesn't necessarily address the issue. The other thing is around actual patient transport by ambulance or etc. when you transfer to the mainland. From painful personal experience, another information and communication point, it might be worth it explaining to patients that the transport will get them there, but you won't bring them back. So there's a situation where if we hadn't taken our own transport, we'd all been stuck in Mainland. So I think there is a lot to be done around communication and patient transport, what it actually covers and when it's available.
Councillor. Running through almost everything that we do. So let's take that away. What I'd also suggest is that between us, we're happy to receive any comments to include and work that through. It's a shame that we come infrequently and get feedback and then something else gets done and we don't include all the comments and make sure that all the comments are addressed. So please just feed that back either through the call or whoever else, and we'll make sure that we put this up as we go forward.
Yes, thank you. I think it's really interesting just listening to the comments that are coming in about transportation. I think there's a lot to do yet as we move forward, and I can't say that this is a starting point because patient transport has been an issue for a long time, but it's an ongoing issue which needs a lot more investment as we move forward, particularly now when money is becoming incredibly tight with poverty. Particularly what's going to happen over the next few months when people grow significantly. So I think there's a long way to go yet, and we seem to keep going round the circle, if I'm really honest about it, in terms of patient transport. We need to break the cycle and perhaps even put together a proper task force on it. But I know that somebody's going to say, well, we've been there before, but we need to keep revisiting, particularly now as we move forward. So the car parking issue, yes, East Cows, you know, there aren't any car parks in East Cows that I paid for, apart from one relatively new one. So I will have a look at that with the rest. But generally, people in East Cows don't park in car parks.
Right, so I'm not sure, Wendy's got her hand up, I'm not sure what the order was. Is it relevant that you speak now, Wendy?
I was just going to, if Councillor Love hadn't said it, Chair, I was going to suggest that this is something that you might want to consider a bit of a sort of task force group around. It is an issue that we've debated before, and we did have a small task force some years ago now, but that looked purely at available information for patients who were travelling themselves and the various discounts that the ferry operators gave. I think since COVID and given the crisis in terms of the impact of rising costs on families and individuals, and giving the changes that we are seeing in commissioning services and how those pan out across the island, I think it's something that we would merit a deeper kind of dive into the likely need for travel and conversations with the ferry operators. And I know that it is something in particular that the Minister for Transport, Robert Courts, would be very supportive, if needed, of calling a meeting between agencies and the travel operators to encourage working together to deal with the patient transport issue. It's something that he has verbally confirmed that he would be willing to support in terms of thinking about transport to an island from the mainland and vice versa.
Thank you, Wendy, and I know the MP is also campaigning on this front. So I've got Darren, and then I've got Michaela, and then I've got Margaret, the councillor.
Thank you. So just support Wendy's comments there. I think from the trust perspective, and almost certainly everybody's perspective, one of the reasons that patients wait for treatment is travel and cost and time, and that deteriorates health, and therefore it's a worry to us, and we therefore support anything we do to do that. But I think we need to think bigger, not smaller. And the reason for saying that is that a relatively modest investment may well save deterioration.
I think Councillor Lily's got a proposal.
I wanted to make a point and then I'll make a proposal. I think there's a number of anomalies. I mean, in Rye, the particular issue is that Wight Link have said they're going to be way into probably next year before they actually bring back ferries after 8 o'clock at night, which actually has a huge thing on people visiting people, QA and a range of things. And actually, it's also loss of staff. I know at least 3 nurses and 1 consultant that are moving off the island actually work in Portsmouth because they can't actually do their job because of shifts with it. So there are a range of these anomalies of inequalities within the current transport system. My proposal is I think we need to take it seriously, and I'm proposing we do set up a new task and finish group that involves other parties, Health Watch and councils, to actually sort of refocus and keep this issue that. And I'm sure that knowing Councillor Jordan very well, he would welcome that. I know the councillor would welcome that as well.
So, thank you.
Can I have a second?
I'll have to second that. So, waiting, I've got Chris Hawkins and I've got Michaela. But in principle, do we support the committee support task and finish group on this? But not at all round. So, Chris.
Very briefly, it's really dotting I's and crossing T's really, but just reading this now, if I go to wherever and pay, the council would be paying me back. Within a week, 8 days or whatever, so that, perhaps I could spend my money on just a way of, dotting I's and crossing T's really.
Thanks for that, Chris. Michaela.
Thank you. I would absolutely support the proposal that's been made. I just wanted to make the link, and Darren said about thinking large on this, and I think it's important. I wanted to make the link to agenda item 8A, which I know Julie Mascree is going to talk on later around the proposed elective hub for Hampshire and the Isle of Wight, because we need to think not just about the transport issues we have now, and I agree there is a massive impact on staffing and patients at the moment, but also where we might be in the future, the models around future delivery of healthcare, the fact that post-COVID, in terms of trying to play waiting lists, there are things like the Elective hub that Julie's going to talk to us about, that Health Watch are doing some engagement with the public on. So we really need to think about what are the transport issues we've got now, and what's the health service look like in 5 years' time, 10 years' time, and think about that. And having, as Wendy suggested, having the minister's involvement in that, I think would be really helpful to make a specific special case for the island. So I'm very keen to be involved in that. Thank you.
Can I just ask a question? Because I know that Isle of Wight Council is looking at the levelling up fund. Perhaps Wendy could answer this. And I know that the next round of levelling up is actually transport orientated. So I presume that the patient transport would fit well with what we're going to bid to government about that. I was wondering whether Wendy can answer that.
My recollection of the levelling up, Chair, through you, is that it's capital related, so it wouldn't necessarily fit in pure financial terms. It's not a revenue bid. However, the link to economic growth, to economic sustainability and sustaining services is tied in as well. So I think it's part of the wider narrative. I actually think we need a lot more information on the sort of models of health we're going to be having in the future to be able to understand what the need and demand for transport will be, so that we can have a more informed conversation with the Minister, both at Minister of Transport and the Minister for Health, because I think there is an ask that we can put forward, but there's too many unknowns at the moment that we need to have the evidence for us to be able to make a sensible and robust case for thinking about the island in a different way.
Thank you, Wendy.
Good, right. So I think we're going to make progress on that. So now we'll go on to the Public Health Partnership. What, Wendy, Simon, this is Simon and Wendy, so I don't know who wants to talk on it, Simon or Wendy?
Very happy. Wendy, shall I start off, and do you want to?
You carry on, Simon, and then I'll finish off with anything. If you haven't already covered it, that's fine.
So, colleagues, this is a paper that has been deferred from Cabinet. It's about the public health partnership between Isle of Wight Council and Hampshire County Council. It started in September 2019, following an 18-month period of review. And this paper it's not about the performance in terms of public health performance, so smoking rates, drug treatment. It's really about the mechanism and the partnership relationship behind that. You can see on page 2 of my report, the front page, we're looking at the grant and the budget, the senior staff time and the team capacity, the public health intelligence and the public health clinical services. And that followed the initial review, and we needed to follow that up because there's still some outstanding actions that we needed to ensure had been reviewed so that the partnership is going in the right way. This report sets out some clear things that have been undertaken. It has strengthened our relationship with the Trust, with the ICS, and brought benefits due to our joint working. We've done a lot of work around the senior leadership, which prior to the partnership was lacking, and we've really kind of strengthened that, and we've had a public health strategy that we are taking forward and reviewing. There's a number of things that we are undertaking, and this report is about how the partnership is working. It's worth saying when this report was written, a similar report was written for Hampshire County Council, and they signed that off. Just worth noting that. And you can see through the report, we look at how the budget is being managed now in a much safer and more robust way. The clinical and public health leadership, really important, needs particular leadership. The team capacity was something that was not working well. And then finally, our public health intelligence service, so that's the data, the JSNA, things like that. And finally, it was about our clinical services. We worked with the Trust and with others to ensure that our clinical services were safe to be delivered for our population. And at times, we found things that weren't there prior to the partnership being put in place. Part of that was around how we commissioned that previously, partly how the provider was working in that space. I'll stop there because I think Wendy may want to add and then can take questions.
Thank you, Chair. If I may, I think from the Isle of Wight Council's perspective, what we've seen since the partnership came into place in September 2019 is exactly as Simon has set out. We've seen an improvement in public health leadership. We've seen an improvement in the way services have been commissioned, and we've seen services commissioned in a really safe and robust way. And that will have positive outcomes for the island community. I think it's just worth reiterating that what the partnership agreement does is it gives us an opportunity to continually look at the partnership and reaffirm our commitment to maintain that 5-year partnership that has been put in place, and that's effectively what this paper does. Simon referred to the fact that it's not a reflection on the performance of the partnership, but I think it would be remiss of us not to say that actually what we're planning to do in the autumn this year is to bring to Policy and Scrutiny and through Cabinet a review of the performance, a review of the public health performance, and at that point we can also discuss how the outcomes within the SLA are being met, or whether or not there's any tweaking that we need to do to the outcomes as well. So fully supportive of the approach that's set out in the paper in terms of recommending that we do continue with the partnership at this point in time. Thank you.
Thank you, Simon. Thank you, Wendy. Can I ask Councillor Lovelay's opinion?
So this agreement that was signed, which I would never have signed. What we need to do is we need to have a service level agreement, not a gentleman's agreement as is written. And we need a full review of the agreement to make sure that it's and an independent review of the agreement. Make sure that it is what it is. Or more positively. That gives us the opportunity to reflect as an island. Hampshire opportunity to racy partnership. The report here is about essentially the agreement that was made, and we would not want to move forward beyond where we currently are, the partnership long term, without having an independent review of those services. What was good, what was bad, what needs to change, what can be improved. So that would be my view. So my view is that this until we have an independent review. We are in the partnership now, and we'll continue with the partnership at this time. Any commitments to long term at this time until we've had a full review set down in front of us, and certainly definitely not doing anything without a service level agreement between ourselves and Hampshire, so that we've got a proper route of accountability, because at the moment we don't have any documents which show us to.
Thank you. I think we need to go slightly back to where we were that got us to this point. And thank you, Simon, for all the work you've done. You know, it has been a journey. This came about after we asked for an LGA peer review. LGA peer reviews are excellent. You know, they really are good to have, because then you get people who are experienced within those roles coming and being that critical friend. When we had the LGA peer review, the public health service at the time that we were being provided was beyond broken, to be fair. And we had a director of public health who was on a huge amount of money. Remembering that is a statutory role, and we always see in the county press how much certain people are paid. Well, can you imagine if we had one person who is at the level that they need to be paid, to do that work just on the island. You've only got to read the journals where, you know, people are advertising those jobs, and you're talking, you know, a director of public health is a lot of money for a small island to pay just for one director of public health. Hence why we start to go down the direction of working with Hampshire, as advised by the LGA peer review, so that we can have a very experienced public health function and have those shared services. One of the things that I found was when you actually spoke to some of the people that work within public health, how they're actually not only just gaining from working with Hampshire, but actually they're giving back to Hampshire as well. And it is that shared skills that's going across the water. We also need to remember that if we're going to have, a service review, isn't it? It's a bit like at the moment, the accountant in me. I go to lots of meetings at the moment where people are showing sets of accounts, and they will show the sets of accounts, during COVID and the sets of accounts now. Actually, we need to actually compare data that was before and after and take the COVID bit out, because actually it's not a fair comparison. So my recommendation would be that actually, why don't we ask for another LGA peer review? They are really useful. Everybody can be involved in it, and then compare that LGA peer review to where we are now with the system that we've got in place, because then you're actually comparing line for line. But Simon, thank you for everything you have done. You definitely came and got us out of a very sticky situation at the time.
So just to pick up a couple of points, I agree with Councillor Loughlin. We do have an SLA, but I think because we set it up at the time when we didn't know what we didn't know, so we can certainly strengthen that. We are proposing to have a review with either an LGA, but a peer review with a colleague. We've suggested working with Cornwall and the Isles of Scilly, because they have a similar relationship with us, and working with the Regional Director of Public Health. So that's what we're bringing through, which will be brought through in the autumn. And I think that's where we are.
So I think if the reviewers with the LGA again, I think we'd be very happy with that, and to review it again in the autumn, to consider it again in committee in the autumn. So we've got Councillor Lilly and Councillor.
I would formally propose from this committee that we support that there should be an independent review, and actually agree with that the independent review should be through the LGA. We've got the link already with the suicide support programme, and definitely the link with Cornwall and Island Cities. We recently had a very good LGA peer review with planning, and one of the things was that the Cornwall and the Scilly Islands had particular relevance to a lot of the issues that we actually had. So actually being with authorities that have those kinds of similarities is important. So I would make a formal proposal of this committee that we would recommend an independent review through an LGA peer review to be actually linked to this process. I've got a second for that.
Councillor Downer, are we in agreement with that? Yes, we are. We did talk about at an informal briefing, Simon, about a public health workshop at Cowes.
Do you want to so the one thing that we talked about in our meeting beforehand, which would be really useful for us as a committee, is the relevance of data and our level of understanding as a committee. I can understand a set of accounts, but actually what is the relevance of how you collect your data and things like that. So it would be really good for us is to have an afternoon where we have a workshop where members of your team prepare for us to give us a bit of more of an understanding. So we, I understand the gest name, etc., but do we all know how it's built, what's involved in it, those sort of things, to give us a better understanding of your role, your team's role, and what's statutory, what isn't statutory, because we are in a very responsible, position here. We're meant to be acting as that critical friend. Well, to be someone's friend, you need to be able to slightly walk in their shoes, don't you, to be able to be that friend.
Yeah. So if you and the scrutiny officer could VAs on that assignment.
Yeah, I'll link with Wendy.
Yeah, Wendy, etc. So I've got Carl first, and then Michael.
Yeah, thanks, the chair, for allowing me to speak this. Yeah, LGA, that was my first port of call. It was resisted by the previous tip, and therefore we moved into a position where, you know, an independent review. So as Simon's has described, they're currently doing their own review and then an independent review. And I welcome the support of this committee within LGA's review. That's absolutely what I asked for in the first place. I think it's really important to remember that whilst statistics and all of that sort of thing, there's an issue here about reporting upwards to government and demand a certain level of statistical return, and that puts a lot of pressure on the public health teams here. And again, this is why I keep saying the relevance to localism is what matters. What's happening on our island, and our priorities should be first and foremost, as opposed to national priorities, which are important and not putting them down, but are driven and supported from our needs on the island and supporting national. That is what really matters.
Right, so I've got Councillor Lilly, I've got Darren and Councillor Moss.
I mean, definitely support the idea of the workshop that Councillor Moss has recommended. But one other thing on data is we do need some up-to-date data, particularly linked to the wards. The data from the past that's still being used by this council and we access with councillors are actually the old wards before the election of 2021. The wards have quite radically changed in some cases. So wards that perhaps weren't seen as deprived or housing inequality are now, right? So we do need to, when we have this workshop, have some up-to-date data that is collected from all the sources, so that we can actually have a picture. In the past, when I've been in previous terms of council, there was a very good book that was given to all councillors, which had very good data and information. We need to have that discussion at a local level, and we talk, about town and parish councils, but actually having that community level of thing, because there has been quite a radical change, particularly in areas of deprivation and health inequalities, and it would be good to actually give some time to actually have that information, because I think often I know one particular council of his name, but doesn't know some of the problems or deprivation in his ward because there isn't that data available with it. And I think we just need to get up-to-date data.
So, yeah,
relevant up-to-date data.
So I've got Darren, and then I've got Councillor Osgood, but I think Simon wanted to respond.
Just put that really quickly. So first of all, we're updating and updating the JSNA, so it's relevant and up to date. The challenge with wards changing, we only have historical data for the old wards, so we have to use those to make sure that, so yes, the wards do change, but we can't go back and change the data. It takes a long time for that to happen. So the JSNA is out there. I can share a link with scrutiny officers to make sure that's with partners, but it's up to date, and more's being done every couple of weeks.
Yeah.
Thank you. First thing to say is that from a trust perspective, and I think from a perspective, we're incredibly grateful for the work of council. Service and function, it's demonstrably better. Incredibly grateful, and we work well and together across all aspects. The second thing I think links to the workshop that Councillor also, and in it, I think it'd be really useful for this committee to see the work that we've outlined as part of the health and care plan for the next 3 years, because it gives the committee foresight of the things that we say we're going to do, and therefore some accountability. So there's needed support and enthusiasm where it's not would be really helpful, I think, for this committee. Third thing to say, a really exciting thing, without overusing the word place, let's just call it local, and we can decide where that is on the hierarchy. The really exciting thing is how do we link that health and care plan as part of the health strategy to the local things that we want to do, make a massive vice versa. And that's the really exciting thing. I think
If we can link that with the work.
trying to pull off over the next few years.
I mean, I think everybody is appreciative of forward. So, who is Councillor Mostel, then Councillor Down?
Very quick one. That's okay. Doesn't work. No, I'll get a megaphone.
Gentleman first, Rodney, I think said.
Well, I don't really class myself as a gentleman, but there you go.
Trust me, you are.
I'm a big believer in keeping things simple. So could I put a request in that when we have the workshop, there's no acronyms and it's presented in simple language, please? Thank you, Simon.
So, Councillor Mostel.
Thank you. Just to say, I completely get, the cabinet members' heartfelt feeling for localism and stuff like that, but we have to understand that there are some roles within this council that are very statutory roles. And I am sure that, the Director of Adult Social Care doesn't want to have to do half the reporting that she has to do. And I'm sure Simon Bryant doesn't want to do half the reporting he has to do, but that is part of their roles and they are driven by those statutory parts of it. There must be so much stuff that the NHS don't want to report on that takes hours and hours and hours. But we are local councillors, county councillors, and we can't change the system as much as we would like. It's like I would like to do half the stuff in my electrical business without having to report every week to the EIC, but that's what we have to do. We are driven by bureaucracy, so I do get where you're coming from, but we do have to understand there is a level of statutory reporting that has to be done. It's a pain in the bum, but it has to be done.
Right, Councillor.
Yeah, I'm not questioning.
Sorry, that's all right.
I'm not questioning that at all. What I'm saying is that the local agenda report, one of the reasons that we're having problems with Dentistry is because of the national agenda, whereas we've been reporting for a long time that we've had a priority and we haven't been able to get over national systems and the systems that they operate in order to get what we want. And that's the point I'm making, is that we knew that this was going on a long time ago and we weren't able to do anything about that. Gone into a national framework accountability. So bringing it back, hopefully, fingers crossed, even if we mess it up, we mess it up ourselves. We don't get messed up by somebody who doesn't know anything about our island whatsoever.
Well, thank you to everybody for their contribution to this item on the agenda, and I thank you also for arriving at a constructive way forward. We'll now move on to the next item, the previous item, item 5, access to GP-led services across the Isle of Wight. And I do believe this is with Sharon or Chris.
Thank you, Chair. So this is a piece of work that we started last year, purely because so many people were contacting us who were having difficulties accessing their GP practice. We talked to other local health watch who were also having similar feedback. So we decided to do a joint piece of work across the south of the country. So from Hampshire, West Sussex, right across to Croydon. The Isle of Wight led on this piece of work. And we already had a huge amount of feedback relating to GP practices, but we decided to do a public survey, and we did that at the end of last year. But we were also strongly aware of the context in which GP practice is working. So the difficulties that staff have faced, the national requirements from the Department of Health and Social Care around what GP practice do. We thought it was really important to make this a balanced report. So we did a survey for GP practice staff just to get their experiences from their perspective. One of the stark findings from the stories that people shared with us was the huge divide between the public and GP staff. So the public didn't understand what GPs were doing. They felt GP practices were not doing anything. They were not seeing people. They were not providing a service. And they found it very difficult to get through to GP practices. And then on the other hand, you had GP practice staff who had a busier workday than they've ever had before. They are doing more work than they have been 2-3 years ago. They're actually seeing more people now than pre-COVID. They're also having to support people that are waiting for secondary care. So perhaps they're waiting for a hip operation, a cataract operation. That support. But there's a huge rift between what the patients see and what GP staff see, and we wanted to try and dispel some of the myths and to try and bring some of that together. So we set up a regional working group last year that included the Care Quality Commission, the LMC, member of the Scrutiny Committee, also some of the Hampshire and Isle of Wight Integrated Care System Communications team. We had practice managers, PPG members, and this group absolutely developed this work in partnership with us. And I think that's why it's been so successful, because it's been truly co-produced by patients, by people, and also by commissioners and deliverers of the service. So we've made some recommendations in our reports. We've tried to keep them very clear and concise. And I just want to emphasise that this report has been really well received by many of the GP practices we work with and with the clinical commissioning group. This is the start of a journey. So this report isn't the end. We want this to be the beginning of improvements both for practice staff and for patients. There are some simple things that can be introduced pretty quickly that will make life easier for staff and for patients. And in the longer term, there's a lot of work that needs to be done around communication. So communication to the public, predominantly around the different roles in GP practices, and also communication from GP practices themselves. I won't go through the results of what we found, but there were some clear themes. There was a definite theme around access, particularly by telephones. Many people struggled to get through on the telephone, and they had to call 2, 3, 4, 5 times before their call was answered. A significant number of people told us that they called their practice, and then when they got to number 1 in their queue, their call was cut off and they'd have to start again. Quite often there's one telephone system, so you have to call the same number for test results, booking an appointment, booking an urgent appointment, or discussing a difficulty with medication. However, there are some really good practices out there, and as we've always said, there is an inequality in access. So we got really good feedback about some practices. So they are providing a really good service and they're doing things well. So we need to learn from that. We deliberately did not name shame practices because that's not in the public interest and would cause anxiety. But we need to be aware that there are some really, really well-functioning practices out there, and we can learn a lot from what they're doing and what people appreciate about those practices. we have the aggregated data about every GP practice. So all of the feedback we've had about those practices will be going to every GP practice, so that they, the anonymised feedback, so they can learn from this, and so that they can understand what people think about their practice and what people appreciate. And we hope, again, our report will evidence to people exactly how hard GP practice staff have been working during the pandemic. They are very proud of what they've been doing and what they've managed to achieve in really difficult circumstances. You know, particularly they've had to face the same issues as the public, with staff going off with COVID, concerns about passing COVID on to their own family members, having to keep patients safe that come to the surgery. So, as I say, this is the start of a piece of work, and we're hoping to work with the integrated care system and with the LMC and the Care Quality Commission to again look at how we can support GP practices going forward, as well as sharing information with the public around what they can expect and how they can best make best use of their GP practice.
Thank you, Joanna. An excellent bit of work, and presented to Crystal Mark standards. So I've got McKellar, I've got Councillor Moslov. Did Councillor Robertson, you have your hand up? Councillor Lilly.
So firstly, I just wanted to thank Joanna, not just for the quality of the work, and I agree around the clarity of the presentation. It's really helpful to see something this clear that can be shared with the public, but also for the approach which has been taken, which is, as she has described, to work really closely with both the practices and the patients. I would absolutely say that I recognise, and we've already spent quite a lot of time, as you might imagine, talking together and with colleagues at the CCG, and Michelle, who's got a hand up, I can see there around this. So we absolutely we recognise all of the messages in here. It's part of the work that is already ongoing with practices to learn from those that are doing well, to work with those that are struggling the most. So the recommendations are fully accepted and will be taken forward as Joanna has described. I think one of the things that we just need to reflect here, and we've talked about it in lots of settings today, haven't we? And I'm sure Michelle will comment on it in a minute, is the work we need to do around managing expectations and the fact that the world is changing, and some of that comes from national strategy and policy. So if you use Darren's, it's a trusted example. If you turn up at A&E, not everybody will see a consultant in Darren's department, because not everybody will need to see a consultant. And because it's been like that for 20 years, people generally recognise that if you go to hospital, you might not see a consultant, because the best person to see you might be a nurse, or might be a physio, or might be a nurse practitioner, or might be a radiologist. And the direction of travel with primary care, and that is encouraged by the government and is funded currently, is that there are a whole range of people who can see you in practice, who can offer you, and we've got some examples in the report, haven't we, in the detail before. People say once they get into a practice, they generally have a really positive experience. They might have wanted to see a GP, but actually they might see a nurse, they might see a physio, they might see a nurse prescriber, they might see a member of the support team, but they get the outcome they need. But the perception is if you can't get through to see a GP straight away, then that isn't good. But in fact, it might not be the best thing. And I think there is something a bit like the work we've already talked around working with the public to help them use the new tools. We absolutely have to do a piece of work collectively that says there are a whole range of people in the practice who can help you, and they're not necessarily a GP, because whether we like it or not, we haven't got enough to go around, and that is a new model of care. So it'd be really good to do some more work on that. But Michelle will, I'm sure, describe those issues more articulately than I have just done.
Michelle.
Thank you. I just wanted to say very much a big thank you, because I thought the report was really balanced, and I just wanted to say publicly that as a GP here on the Isle of Wight, that I thought it was a really balanced report, and it was really good to read such a balanced report. I think what has also happened when I reflect is that the communication that we send out to our members of the public, it hasn't really caught up with what's been happening in a national drive over the last 5 years. We know that there are too fewer GPs for our population. It takes 10 years to train to be a GP. You can't fix that problem overnight. And so what the government's done is we have a whole extended workforce now that work extremely well in an integrated way with GPs. So we have lots of multidisciplinary meetings so we can discuss patients, we have tutorials, but the general public want to see a GP, and when they can't see a GP or they wait a long time, they feel disappointed. And I really do think we've got a big job in the communication to explain to them that, as Michaela has already said, seeing an advanced nurse practitioner is often much better than seeing a GP. They have longer appointments, they're very capable, they're very well trained, and they can deal with a whole host of problems. And when somebody sees an advanced nurse practitioner, they come out usually very satisfied. But in the initial thing of not being able to see a GP, it tends to lead to some disappointment. And then the third thing is access, as in phone access, as in how do you get through in the first place? Because if you've been trying 3 days to get through to your GP practice, by the time you're doing that, either you're going to be quite poorly, your problem's going to be solved, or you're going to be extremely harassed, and it's never a good way to start a consultation like that. So I think we've got a lot of work to do, but I know I've emailed Jo privately, but I just wanted to say thank you to her publicly because it's a really good report. Thank you.
Thanks, Michelle. Right, I've got Councillor Boston and Councillor Lilly. Then I've got Darren.
Thank you. An excellent report, but sometimes I wish that we could think bigger. Part of the problem with COVID is we were looking into lots of innovative stuff, and then actually COVID came along and everybody was like swans, floating on the water and the legs going madly at the water just to keep afloat. But I think we need to revisit some of that work and looking at how other systems actually provide a GP service that embraces and helps the service that is already there. So, for example, in North West London, we were looking at the system they had, which was Babylon, which is where you can actually, and it's run by the NHS, so it doesn't take away from the GP. But one size doesn't fit all, does it? I know that I would be, in my busy life, I would really like to be able to video, not phone call, but video call a GP. They can, Michelle's known me for quite a few years, but you can tell by when you look at somebody over a screen if the colour and the tone of their skin is how they're feeling. You can't tell that on a telephone call. But some of those systems that that are already being embraced by other NHS trusts to take the pressure off the GP practices to provide a service that not everybody would use, but quite a few of us in the room, if would actually use a service like that. I think we should revisit and start to investigate, because actually it would help the GPs if they had some pressure taken off them as well. I don't want to go and visit the GPs. It's not full of lots of sick people. I'd rather sit at the end of my computer and have a video call. But I think there's so much that we were looking into, and I think definitely we should try and revisit that. But thank you for the report. I think it's brilliant, and thank you for the people like Michelle, who've done such amazing work during such a difficult time.
So, Councillor Lilly.
Thank you. The first to actually thank the excellent report from Healthwatch. The standard of reports that come out of Healthwatch are brilliant, and we're so lucky to have that local service. And the fact that you're actually leading on this with other Healthwatches shows your high regard in other areas. So we definitely want that recorded. I'm going to go straight to actually just making sort of 3T proposal, really. One is there's clear recommendations here, and I think we as a committee should accept those recommendations, which are on 51, because that is actually listening to the report that Healthwatch has done. So I propose, firstly, that we accept those core-based recommendations and recommend those to our stakeholders. Two, that we actually go on record of thanking the GP surgeries, and then we've got that formalised, and we actually possibly write to all those GP services as a committee to actually thank them for their work, particularly over the last few years, and recognise. And my last point is about good practice, that we actually publish or communicate good practice, not just on the island, because I think as Councillor Mosdell there is that there's other good practices that could be integrated on to the island. It's far better to celebrate what is working well and criticise what isn't working well. And I think we should right across health publicise some very good practice in our community that doesn't actually get enough. So actually praising GP surgeries where they're actually doing well. I know in Tower they're doing excellent work on social prescribing and actually on mental health. It's actually reducing the number of people coming into acute services. Now, we need to celebrate that and actually that. And I tell you, if you're a restaurant and you really celebrate and you've got a good rating, it improves all the other restaurants very quickly.
You might have written it yourself though.
Right, I've got Darren and then I've got Councillor Mosdell.
Thank you.
Oh, we got a proposal, we'll deal with that in a minute.
Right, can I have a second of the
We'll come back to the proposal then in a minute, Michael, if that's all right.
Thank you very much. Thank you, John. Thanks, Chris. I think it's an excellent report. And I'd echo Councillor Lilly's comments from standing that you are in. I think the other thing just to say is that over 1,000 people respond. It's an issue that needs working through. You know, it's not one or two, it's a number. And I strongly think it's about expectation and management. And there are two issues for me. I think the first is the rest of communication. A lot of the changes that have happened in and to primary care, some of which have been imposed, some of which have been local decisions that have been taken, all for the right reasons, but often with little or no communication. And I think that's the underlying issue that we need to address first. And if we can resolve the communication aspect, I suspect that Michelle, actually, a large element of the services remain brilliant because 90% of our healthcare interactions happen in primary care. And our primary care service is stretched but fantastic in the island. We need to celebrate it and we need to continue to perpetuate it. But actually, I think we can go a long way with the communication aspect of this to resolve some of that, what I'll call dissatisfaction, the complaints, the griping, defensive behaviour, all of that sort of stuff. And I think we can try and do some of that through those recommendations that you outlined. I think that's really helpful. The second thing I think is more fundamental, which is lots of things have changed during COVID, some of which need to go back, most of which don't. Let's take the good things through the COVID period and build on those as we move forward. Some of the things, Michelle, you and colleagues have introduced benefit hugely. You've seen an unmet demand. That's also creating problems in primary care. So how do we work collectively across the Isle of Wight and wider if necessary to make those changes more sustainable and particularly involve the users of those services in designing some of those changes as we move forward? I think that's the trick that we've got to resolve the concept fairly quickly, but actually it's those wider changes that I'm not even going to make a parochial point about the pressures on urgent care.
So this evening we seem to be listening to this common theme that's coming through, that actually people don't want to be able to or can't embrace this digital age that is coming towards us. Maybe it would be worth the ICP talking about maybe putting some funding into something like Age UK. I know that they teach people how to use their iPads and stuff like that, but actually put some funding in that teaches people how to use that technology for specific purposes. So not just the ordering of a pair of shoes, but actually how to use that NHS app, because it's the fear of not being able to do it.
Yeah.
So if you were sending people out to actually give courses and help people to use that technology, but for a specific purpose, you might find that you've got more people embracing that system.
I'd already made a note earlier in the evening that we should do just that, so.
Very good point. Councillor Lee, you-
Sorry, one more point. I like the proposal, but please can we not write to people? Can we email them? Because the cost of this council with paper and stamps is obscene. I've only just got to look around the room and think how much was spent on postage sending all these papers out to people. So could we email, please?
Joanna.
Thank you. I just wanted to add that I absolutely agree with what's being said, but we need to understand that some people don't have access to the internet at all, and some people do have a mobile phone or a computer, but they can't afford broadband, or they can't, they have a pay-as-you-go phone. So we do have to make sure that we've got provision for those people, so there is choice. It's not just a drive towards pushing everyone to use IT, because
dyslexia.
Yeah, and people with a learning disability may
As I said,
some people,
not one size fits all, does it?
absolutely, yeah. There's got to be a choice there for people.
Excellent. So, Michael, would you like to just go through your proposal again briefly, if you can?
My proposal was to accept the recommendations in the Isle of Wight Health Watch report, and to recommend those to the stakeholders. To a thank you through email to the GP surgery that we as a scrutiny committee had actually felt that we need to publicly thank them. And the third was using more examples and perhaps publicising examples of good practice as a way of helping to improve standards, and highlight, because their GPs do lots of different things and highlight different things that are coming from those GPs. I'm sure Michelle will be able to link to the GPs and pick out some of those excellent points of good practice.
I think we've got a shared vision on this for partners right across the board, but excellent proposal, Michael. Do we have a seconder for that? Councillor Robertson is seconded, and we're all everybody in agreement, so you can have that or not. So yeah, we're all in agreement. Well done.
Chair, could I just make one point? One of the things which I've asked for before, I think, Health Watch actually sits on the integrated care itself, rather than being it really does need to be there.
Can I answer that? Councillor Love's mentioned that before, and I actually think it's a very sensible proposal. However, we are just looking at the governance of the Integrated Care Partnership Board, and that will be looked at. I totally agree with Councillor Love. I think Health Watch would need to be sitting around the table. However, we do also have other members who represent other areas that I think need to be sitting there, but it's not my decision. It would be a decision made with a group of people. So, for example, representing care homes, they do an enormous amount in our system, and I think they have a place to potentially sit around the table as well. So yes, it absolutely is, and we're just looking at that as well. So your suggestion has been noted before, Councillor.
I think members are very satisfied that you're looking at all this, Michelle.
Thank you.
So this nicely leads into item 7 now, which is the Integrated Care Partnership update, and I think you're in the chair for that, Michelle.
I am indeed. I'm hoping to share it with Darren actually, though, because he may have some more direct information which I haven't yet received. As I understand it, we're having just a very small pause on our development. We're going to be still implementing quite a lot of the community transformation plan and other really important works, but the actual governance and development of the board, I understand, has been paused until September. I think Darren will be able to give exact details on that as I've not received them yet, but I understand it's been paused and then we'll regroup in September. Is that right, Darren?
Thanks, Michelle. I'm about to say something else. People leaving the room. So you're right, Michelle. What we decided to focus on in conjunction with the ICS, focus on doing things rather than designing a structure to enable things to be done.
Yeah.
So that's what we decided to pause the structural aspect of that. As Michelle talks about, the community transformation is get on and do some things, particularly relating to frailty and trust.
Good. Questions?
Oh, sorry,
Can I just say,
another debate, sorry.
can I just say that frailty and mental health are
Absolutely.
They are.
two big issues on the island. And I think there's clearly frailty, particularly
Yes.
I think I'm observing much more within that and getting much more reports on the ground today. Thank you.
Absolutely, Councillor Lilly. There will be a huge focus on frailty and, importantly, dementia strategy as well, and looking at mental health, but particularly looking at how we can integrate our services so there are not duplication and they are aligned. And so, obviously, you've had the health and care plan many times, and that's obviously very much part of what we're going to be doing over the next few months. A very, very exciting time, actually.
Good. So can I quickly say, you mentioned the dementia plan. Can I, again say publicly, that's an extremely good strategy. And I think it's extremely good because you actively engage with groups like Health Watch, Isle of Wight Carers, Age UK, all the stakeholders in this, and particularly most important, the families, right? Within that, and I just think that's a very good model if we talk about good practices of, going forward. Obviously, this committee needs to scrutinise put the words into action, but I think we need to really praise where we've actually got it right, and I think we've got it right on that.
Good, thank you. We'll move on to item 8, which is service charges, and I think we've got a couple of guests. Service changes, sorry. Should have gone to Specsavers. We've got a couple of guests from NHS England, Elizabeth Kerwood and Julie. So, who have we got here?
That's Julie.
That's Julie. Julie, over to you.
Yes, thank you, Chairman. Thank you for inviting me. I'm just going to say that I can't actually see the room, so please forgive me. And occasionally the sound goes in and out, but hopefully you can hear me in the room. So thank you for inviting me along to come and talk to the committee about the plans for the Hampshire and Isle of Wight Elective Hub. We're pleased that as a system, we were one of just 3 in the region that have made a strong enough case to NHS England on behalf of the integrated care system that we've got a need to create additional capacity as a system to help us deal with not only the backlog, but the growing demand for elective services that we've got in our ICS system across Hampshire and Isle of Wight. We know that the development of these hubs is seen as best practice nationally for the reason that they are ring fenced specifically away from non-elective pressures which occasionally throughout the year we've seen a number of cancelled operations because of the increasing emergency activity that takes place in our hospitals. So these hubs that are being proposed across the country, we are one of 3 in the South East region. And so we're at the stage now where we are putting together our outline business case. So whilst we've got plans emerging, there's still a great opportunity for stakeholder engagement so that we can take on board the views of our stakeholder partners and our patients and the public in helping us develop proposals that work for all our patients' populations. And so, as Joanna mentioned earlier, we're working with Health Watch, particularly around patient engagement for patients that are currently waiting in our system for treatment, so that we can understand the issues that they may perceive that we might need to address in our plans as we go forward. So just to give a quick overview, what we're proposing is a 4-theatre hub that is completely available 365 days a year for operations to take place. So we won't be admitting any emergency patients, and it's available to patients and the trusts across the patch, so the Isle of Wight, Portsmouth, Southampton and Hampshire hospitals. The location that's been chosen has been is the Royal County Hospital in Winchester. In terms of the geographic area that's being covered, and it will involve 3 particular specialties which will move their activity, not all their activity, but some of their activity into the hub. And those 3 specialties are orthopaedic arthroplasty, which is hip and knee surgery, urology treatment and ear, nose and throat treatments. And they've been chosen because they are what we call high volume, low complexity procedures, freeing up then back in the home trust, the 4 trusts, theatre capacity that can treat other specialties. We've done an overall demand and capacity analysis. We're in the process of doing that so that we've got evidence to show how much additional capacity, theatre capacity and bed capacity we have to provide, and how much the hub will deliver in order to help us with our long-term plan of meeting the activity that we need to. And the proposal is that the consultants from each of the trusts in those specialties will be able to come and offer choice to their patients at the point of outpatient. So patients will have their outpatient appointments in their normal trusts. And if they meet the criteria in those 3 specialties and would like to have their procedure in the hub, they'll be given the choice to be listed to have their procedure there. So I must emphasise that this is about choice for patients. And their consultants will come and operate on them in the hub should those patients choose to come and have their procedures. Because of the types of procedures we're looking to offer in the hub, the majority of patients, because of their criteria, will be able to have their pre-assessment appointments done virtually. And I've heard in the conversation this evening about giving people support with access to online services. And so that will be one of the important things that we'll need to take into consideration. So for the majority of patients, we think around about 90% will not need to travel to the hub for their pre-assessment appointments face to face. And for, we haven't quite concluded the planning, but for patients in the Isle of Wight, because of the distance to travel, we are looking at how we can accommodate the pre-op assessment for the Isle of Wight patients in particular, in terms of those that may in the 10% need to have face-to-face appointments. Once patients have had their procedures, the plan is that they will be followed up if that's required back in their home trust, so they won't need to come back to the hub. In terms of transport, again, this is a really topical conversation, and I've heard the debates tonight, and we would welcome being part of any task and finish group to look at how we can service the transport needs of patients. We've been to look at the hubs in southwest London and Northumberland. We've taken some advice, and we know that those facilities offer transport to patients who need to have support to attend their appointments. So we will be looking to provide transport for patients that have an identified need to access the facilities. So the timing at the moment is, as I said, we're in our outline business planning stage, and we are taking consultation and involvement from all the different hospital trusts, our community partners and the clinical teams to help us design and develop a successful model, with a view to submitting our business case later in this calendar year. And we're hoping that we will be given the identified funding, capital funding, to take the scheme forward. With a timeline, we are hoping to be open in the mid-2024 calendar year. So happy to open it up to any questions. I hope that gives you a good oversight of what we're planning at this stage.
Good. I have Councillor Mosdell.
Allows me to speak. It's start to go, Richard and Joe. It's your turn now. It feels like. Oh, I don't blame you at all, but you should hear me sing. I'm quite good at that. So my question would be, it's not just about transport needs. It's about transport experience. So, you know, I completely get it that, you know, if I'm going to have my hips and my knees give up all the running that I'm doing, I would like it to be done, you know, to be replaced by someone who does loads of them, rather than someone who does very few. I want them to be done by an expert in their field. But actually, the transport issue is huge for the island, and it isn't just the cost, it is the whole experience. If you are taking somebody who's had a hip or a knee operation, and then you are asking them to walk up 3 flights of stairs because the lift isn't working on the ferry, or who are very vulnerable and susceptible, and they're travelling on a day when one of our ferry operators has overbooked themselves, which is on many occasions, that people are then left sat on the floor, etc. There is this great bigger picture that needs to be looked at. And as I said, it's not just about, and it is us on the island who have lived and breathed it over the years, who are the ones that really need to be spoken to about it. It is a huge issue. It's never been resolved. It's not been resolved, you know, for as many years as I can remember. And my daughter's 27 now, was taken for an operation in Southampton years ago when she was 2. And when she'd had the operation, it was there, it's done now, you can go home. And it's not as easy as that. But, you know, we just need to get to this point that it's not just the cost, it's also that experience. And people need to, this is an island where people, social media, everybody reads it and does whatever. If you get it right, then very quickly all people will actually say that I want to have it. If you get it wrong, then actually you won't get anywhere with it.
Yeah, I can understand that totally. So I think it is really important that we cover both the access to transport, but the quality of the transport offer that we provide for patients. So yeah, very, very happy to be part of plans and just further discussions around that.
Well, I've got Darren and then I've got Councillor Latham.
As I said earlier on, anxious, worried about patients waiting on. Just totally supports this. It's something that we increase capacity within the system to enable more patients to be treated faster. So lots of questions. Julie, you've raised some of them this evening. Councillors will continue to raise more questions as we go through around implementation. So how do we make it work well and best for our population, quality of transport, etc. Lots of those things. And I think the task force that we agreed to set up is a way of interacting between your team, Julie, and the island then to make sure that we capture all of those ideas. But the Trust does support this. It may well mean more patients travelling, but their care would be quicker and would be done by our local surgeons by and large.
Very good. I think that's really refreshing, Elizabeth, your openness. So I've got, did you want to, it's Councillor Love.
Your members first.
Can I just add something to it? Sorry. So I've got this thing about, you need to learn from other systems and stuff like that. So we've got some friends who live in Spain, needed a knee and hip operation. And what they do there is the family member is allowed to stay overnight in their room. And actually, that's more relaxing for the person that's having the operation. They feel more safe and secure. But also, if people are travelling and stuff like that, it's easier to travel and stay with that person within that hospital. It just might be worth you looking at. I know it's like the thing, we don't want anybody sharing wards and stuff like that, but it makes the whole experience a lot easier, and it also would take pressure off yourself if you actually accommodated a family member staying within the room. If you try to book a hotel in Southampton at the moment, or Winchester, it's a ridiculous amount of money, and it's also, if you're talking about doing a ferry, if someone's having an operation and they need to recuperate in hospital for 2 days, that's actually 2 lots of journeys backwards and forwards that person has to do. So it's just worth maybe bearing in mind.
Okay.
Very good. I've got Councillor Love and Councillor Lilly.
I've got more squiggles on my bit of paper now than I think I know I'm to follow it. I mean, this is why advancement and technology, great, no problem. But great. Winchester, terrible. Terrible. People travelling from here to Winchester. So that's one thing. Second thing is, let's speed it all up and bring adult social care to a complete standstill, which seems to be the agenda of the government. Let's bring it all to a complete standstill. We can't care for what we've got now, never mind what we're proposing, because we use words like faster. I mean, we talked about stakeholder engagement. I'm sure they've engaged with you about this, and they certainly haven't engaged with us as an island population about this. And if we're talking about localism again and being able to, so yes, it will resolve some of your medical model issues, but our community model is significantly affected by the medical model which you're proposing, and there's been no real discussion with us because of the things which have been quite rightly pointed out by Councillor Musdale. We're an island, people have to get on and off, we've got all of these problems, and we've got no workforce. So if you're telling me, which I'm really looking forward to hearing, how are you going to fund all the additional adult social care staff to fund this project, then that'll be really quite good to hear that, because some people will need escorting on and off this island as well. So it brings a whole load of new questions. Not for these operations. Our population is the elderliest population in Great Britain. So there's a significant element here who will need support and escort off this island. And when they come back, depending on what operations you're doing, unless of course you're not going to do the operations for all the people, because so what I don't get here is why there hasn't. We've talked about stakeholder engagement. You've not engaged with us.
We are at the stage of engagement now, as I say.
Yeah, after the event and after you've decided it's in Winchester.
So it's probably worth just responding to a few of your more generic points rather than specifics, Councillor Love. The first thing to say is the engagement has started. That's part of what Julie is here for. We're at outline business case stage. There are a number of criteria within that business case which indicate that Winchester is the preferred location. Now, from an Ireland perspective, we'd like that to be somewhere different, but across the Hampshire and Isle of Wight, ICS, ICB, that's the preferred. So there's no getting away from that. Can't run one here. Or anyone thinks that. We can't run one here, so let's discount that. So there does need to be one somewhere. The consultation exercise that Julie's outlined starts now through that business case production process. Joanna and colleagues have already been involved to some extent. I think the issue around adult social care is one we need to come back to, Councillor Lowe, if that's possible, and rather than do that as part of an elective hub discussion, it's about elective surgery for patients to have what Julie describes as high volume, low complexity surgery. Now, to the NHS, the hip replacement is a high volume, low complexity. To everybody else, I appreciate it's not, for all the points that Councillor Mosdale talks about, but we are the experts and we can work that through. The issue here, I think, Councillor Love, is if we don't operate on the patients that require this care, deterioration in their condition will happen, and therefore further need, particularly around adult social care, domiciliary support will be required.
I'm not remotely suggesting that.
So it's better to operate earlier in a patient condition, and that's what the proposal tries to work
So
through.
what you've just suggested is that wasn't I'm suggesting. I'm not suggesting that at all. Those people need their operations where the whole system responds, because what we've got is a medical model response, and we're part of a whole system in adult social care, which is vastly under-resourced at the moment and doesn't have the staff. So that is what they've got to deal with. If it was nearer to the coast, it would be better.
Apologies if I misunderstood.
It seems as though the decision's made.
Sorry, can I make a point? Yeah, it's a pity. It's a pity the director for adult social care is on holiday, but I think we need to pursue that through.
Nobody's spoken to me about it.
We'll follow that up, Carl. Michael.
Yes, I think we have to move on. I think the particular point you made about being part of the task and finish group that we have already agreed on, and I think within that actually look at the minutiae, the reality of someone in a lot of pain, right? Actually travelling from their home over a ferry, and I'm telling you, you know, if it's on a November night, it's really, really hell. Right, we know that. And how then you get to the other side and also having the carers, the family around that person, and also that they're welcome. Because I think a lot of the people, we've got lots of lessons of where people have literally been left at the door and it's been late at night and then we know where to go, etc. So let's, through the task and finish group, look at the reality of that travel and how can we do things. I mean, a good example, the COVID travel through COVID, they purposely built a place where people were being travelled for emergencies. They had members of staff that were trained to actually look after them and everything. It's a really good model there. You know, can we get Wight Link and training their staff to make that journey as comfortable as possible? Let's look at the practicalities of that. So thank you.
Right, I've got Councillor Moscow, then I've got Joanna Smith.
Thank you. And my understanding of this is the start of the consultation process. So from my point, I thank you that making this very important committee one of the first on your agenda to come and speak to us to explain what your process is going to be. As you quite rightly said, you haven't even applied for the the model and the funding yet. This is the start of a process. So I think we should all be quite pleased that you put us quite high up on who are the people you're coming to talk to get our feedback. I think we do need to be really aware how debilitating it is if your hip's gone or your knee's gone. And actually, the longer that an elderly person is not able to walk or leave their home properly, actually gives them all isolation issues, and actually gets them to a point that they become practically agoraphobic and afraid to go out. So it's not just a case of we need to get it done because of the pain. We need to get it done so that people can actually become back involved within their lives. Because my mum had a hip operation. She was in agony until it was carried out. As I said, the most important thing for us is to hear about what the experience is going to be for transport, and maybe if you could come back and speak to us again in the future to actually bring back some of these things that we've spoken about, so you are starting the consultation process now, and how you're going to resolve some of these issues, remembering that when you talk to this committee, the media are here. I think Louise from the County Press is sat right behind me, so I'll be talking eloquently to you, not ordering trousers. It's a standard joke, you'll get used to it. But yeah, thank you ever so much for coming to talk to us. It is the start of a process. Councillor Love is completely right, but we do need to work across, you need to be shown that you're working across the whole system, so that if someone is going for their hip operation, that there is enough stuff with the community equipment store that has been taken to their house, ready for when they are discharged from hospital. It is that bigger picture of how we all link and work together to make sure everything is in place before somebody has their operation. Thank you.
Right, Joanna.
Thank you. I'll make this brief. In conjunction with the other local health boards within Hampshire, we have got a survey out at the moment asking Island residents whether they would be happy to go to Winchester for treatments, and if they were, what support they'd need to do so. So it's the results of that survey will be critical, and they won't like me for saying it, but we've had double the response of Hampshire so far, and I just think that kind of emphasises the significance that Island residents, have on this. But also, my only concern is that should it go ahead and the hub be in Winchester, Hampshire residents are likely to agree to have a procedure in Winchester because it will be convenient to them. Yeah. What's to stop Hampshire residents taking 100% of that elective capacity and the Isle of Wight getting none, and then us being disadvantaged because our island residents are not able to go?
Right, so McKenna.
Thank you ever so. So absolutely agree with all the points that have been made around carrying and transport, and I and Darren, as you might expect, when articulating that to Julie, and Joe, Darren's Director of Ops at the Trust, has been involved in those conversations as well. A couple of things I wanted to say. The first is to reassure you that we're already having conversations with Julie around how the modelling would work, Joanna. So the feedback from the public is really important about who might want to go and what they would need in support. And then the financial model that underpins that says how much does each patch get? Does that make sense? So that Hampshire, for example, couldn't take all of it, or we conversely didn't end up with more capacity than we could fill, which would also be a problem if we were given more than we could send patients. So that conversation is ongoing, and I completely hear that. The other thing I wanted to stress, just to make sure it hasn't been lost in the conversation, is what this isn't is a proposal that says we are only going to do hips and knees and urology and ENT at Winchester. Does that make sense? So the proposal is around making sure that we can expand overall capacity across all sites in Hampshire and the Isle of Wight, so that patients who do want to move and think the support is there can choose to go there. And but recently with hernias, we've had 50% of patients who we've offered have wanted to go elsewhere, which has been really positive. But the 50% who don't, we won't be saying you've got to go. Does that make sense? So this is not saying everything is going to move. It's around saying we're putting extra capacity to allow us to offer patients more choice and try and reduce waiting times.
Good, right. So, thank you very much. You can see the strength of fear that was on the Isle of Wight, frankly concerned. Thanks for raising that up. And thank you. I'll call it's Julie, isn't it?
Yes, it is.
From here, but thank you. I think I'll call you Elizabeth. Thank you very much.
And I'm very happy to come back, Chairman, and keep the committee updated on our plans as we progress. So thank you for having me.
I've got to host a meeting in 35 minutes in Rye.
Thanks, Chris.
I haven't said much tonight, but what I've heard, seen and heard tonight, commitments that will actually provide the foundations of a positive change in health. Albeit there's a hell of a lot more work to do. So we've all got to keep at it. Thank you all for all your help so far. Thank you.
Thanks, Chris. So we can move now on to the Trust End of Life Care, Darren.
So I'm going to happily pass this on to Lois. It's a great news story, I think is the summary.
Good.
And I will offer the apologies of Shane Moody, who is our clinical director for end of life care, who had intended to come and would have been a lot more eloquent and well informed speaker on this point. But I am very pleased to present the report to you. And I would apologise that it's ended up on your agenda as a service change proposal. It isn't actually a service change. It's presented to you for information and to highlight good practice that's taking place on the island that will help the island to meet the expected change in legislation that's coming in years, which will require acute providers to deliver end-of-life care in hospital settings. I won't go through the report in detail, but to highlight a few of the important elements of it. Just under half of those who die on the island every year die in our hospital. That's not. And a significant majority of the other people who die on the island die in our community services as well. And the majority of those, the significant majority of those, are expected deaths, where the Trust's care has a great potential to make a significant impact on the quality of the death for that patient and their family. It's undoubtedly the case that through the pandemic we had to change our focus and think much more clearly and carefully and quickly about end-of-life care and the services that we provide to dying patients. But we've been working for some time on measures to help improve the recognition of and response to impending death. The Trust has been very innovative in its developments in the care of dying people, and it's at the forefront of practice nationally in a number of important aspects of this care, notably the fact that we got a clinical director for end-of-life care. I think it's also relevant that that's a nurse rather than a medic. I think it shows that we understand that it's a very holistic approach to this part of care. We have end-of-life care champions at all of our wards. We've got a very effective partnership with Mountbatten. We have innovative ways in which our ambulance crews can support people at the end of their lives who are dying at home with the administration of end-of-life care medication. We've got a paediatric end-of-life care consultant now. We have got psychological input to our end-of-life care services, and we have Wellow Ward, which is the only dedicated acute ward for end-of-life care in the country. The report describes the many ways in which our staff are empowered and enabled and trained to support dying patients and their friends and family, and to ensure that the care provided isn't just clinically focused, but it's holistically based on their needs. The report's got lots of narrative in it, lots of stories of how we support people, but it's backed up by data which shows and provides assurance to the Trust and to this committee and the people on the island that the Trust is committed to delivering very high standards of care. The report also sets out in part 7 the details of the Trust's further ambitions in connection with end-of-life care and the developments that we're expecting to make in the coming years. So we present the information to you for interest and information. I would be very happy to answer any questions, but might not be as many as Shane would have been.
Questions?
John, can I just add how incredibly proud we are of this service? It's just an absolutely fantastic. And that's been recognised in this report. It's also been recognised nationally. We should all, there are a number of things that we need to improve, we need to work on. This will continue to develop and continue to evolve and continue to improve, but where it is right now is absolutely.
I think we can just offer you congratulations and where you've got to. And where you've come from, quite a change. Councillor Lilly.
I just really wanted to reiterate that, and actually just a minute thank you, because you have come an incredibly long way from previously, and I think that the development of this holistic, I think it'd just be good perhaps to come back to a future meeting and develop further, so that we can actually perhaps have more time. It's always a bit, isn't it, when you've got a good news story, which actually should be at the beginning of the agenda, and we're all a bit tired now to actually go into probably the detail that this deserves. But I think that the fact is that I propose that we accept the report and make sure that we, when you come back, that you're at the beginning of the agenda, and we can actually give the time that this is deserved, because it's a very important side. And I think all of us have probably got experience of people who've actually been in this service, and I have to say personally, the humanity of the staff team at that, which is the most critical. You can put up with lots of things, but you actually want kind, humane voices that are with you at that time, and you definitely have that from my knowledge of the service. So thank you.
Good. We've got a proposal. Do we have a seconder? Councillor Robertson. And are we all in agreement? Not yet, everybody. Yeah, we're all in agreement.
Thank you.
Good. That brings us on to the work plan. That's quite an extensive work plan. I think given the national news concerning Norwich University Hospital, and I know the risks that we have with our own maternity department, given the low birth rate on the island and the challenges that represents. I think it would be timely, Darren, if we could ask for an update maybe for the next meeting on that. Is that in accordance?
Happy to do that, Chair.
Councillor Green?
I was going to put this in a question, but I'll avoid it as a question because I link it to the work plan. I think we know of the cost of living crisis happening, and we actually know from information the housing crisis, and in the context of Maslow's hierarchy of need, if people are actually faced, or families are faced with homelessness, their health, and particularly mental health, going to deteriorate. I've been very concerned that you have a private rented sector is just crashing on the island, and you now got a number of medium-sized private landlords that are moving to Airbnb, and you know this is actually going to increase with quite a lot of families being evicted and coming into the system. So I'm proposing, is it possible at a future meeting in the autumn, Jamie, that we could actually have linked to public health, look at this issue of the health inequalities and homelessness and housing on this agenda. I know it would be on other agendas, but I think we have to look at this from a health inequalities perspective within that, because it definitely, I mean, we've all got experience of the areas we're coming to, but in Ryde, there isn't availability of secure housing for a lot of people who cannot afford to buy their own home, who are working, who are now going off sick, absolutely frightened of what's going to happen to them in the future. And that will obviously affect them going to GP surgeries and mental health. So I just would like to own that issue on this committee.
Michael, I'm just wondering whether we couldn't combine this with the, I'm looking at Jamie, with the public health workshop, as it's all sort of very
around deprivation. Yeah, thank you.
Councillor Mostyn.
I'll be really quick. So my question is for Jamie. So I used to know, like on a daily basis, how many people were, you know, on housing registers and stuff like that. I listened to a bit of a train crash of an interview recently, where certain councillors didn't have a clue how many people on the housing register. Could you give us the updated figures, please? Because it is a seriously desperate situation, but a brief update on how many and etc. would be quite good for this committee.
There's around 2,500 on the housing register. That's been relatively static for the last couple of months. There's been a process of renewals which has seen a small number drop off. Numbers to access the housing register continue to be quite
The severity of need is increasing, I would suggest, in terms of families that are requiring emergency accommodation at the moment, and that's been well publicised and reported more recently. And the health inequalities that are associated are well documented. So I think there's lots of work for us to do, and I will look at providing a report to give a bit more granularity to help inform and shape our reports.
Good. Any more questions? So I think that draws to the end of a very good meeting, I think. Thank you very much for everybody who's exchanged their views, whether, you know, we've worked through some difficult subjects tonight. Thank you very much.
Thank you.